Today, we're diving deep into one of the most intense situations a first responder can face, a childbirth emergency. We're going to break down the exact step-by-step plan they use. This is a real race against the clock, where every single second counts.
All right, let's jump right in. Picture this. The call comes through. A new mom is in serious trouble. You get to the scene, and it's chaotic, it's scary, but you're not just running on adrenaline. You have a plan. So what exactly is that plan?
Okay, first things first, we have to know what we're up against. We're talking about a really serious complication that can pop up out of nowhere right after a baby is born. So this is postpartum hemorrhage, or PPH. And let me be clear, this isn't just some bleeding. We're talking about a massive, rapid loss of blood that can become life-threatening in just a few minutes. It is, without a doubt, one of the scariest things a first responder will ever see in a childbirth emergency. So how do they figure out what's going on? Under all that pressure, they have to read the signs and fast. You can't fix a problem if you don't know what it is, right?
They're trained to spot a very specific trifecta of symptoms. Is the patient confused or not totally with it? Is there visible bleeding? And are they showing signs of shock? If you see those three things together, that's a huge red flag for PPH.
But here's where it gets tricky. It's not always a slam dunk. They've got to play detective, and fast. Could it be PPH? Or is it something else, like preeclampsia, that's super high blood pressure, or even sepsis, a crazy dangerous infection? They have to rule those other bad guys out to be sure they're treating the right thing. Okay, so once they're pretty sure it's PPH, that's it. No more waiting. A very specific action plan kicks into gear. And I mean immediately. Every single step is followed to the letter. Think of it like a life-saving checklist. It's not just a random list of things to do. It's a carefully crafted sequence where everything happens in a specific order for a reason. And here it is, the roadmap itself. You've got 5 key steps. It starts with assessing the situation and getting the patient in the right position. Then they do something called a fundal massage. After that, they administer a drug called TXA. Then come fluids and another drug, pitocin. And finally, it's all about getting to the hospital, fast. This whole sequence is designed to stabilize the patient, step by critical step. And every single one of those steps has a why behind it. Like, why put the patient on our left side? Sounds simple, right? But it's actually a huge deal. It takes the pressure off a massive vein, which helps get more blood back to the heart. And more blood to the heart means more oxygen for the brain and other vital organs. Simple, but brilliant. Okay, next up is the fundal massage. This is a hands-on technique. See, after the baby is born, the uterus is supposed to clamp down hard to stop the bleeding where the placenta used to be. But sometimes it doesn't. It stays soft and boggy, and that's when you get that terrifying bleeding. The fundal massage is basically a way to manually tell the uterus, hey, squeeze down, now. Now we bring in the big guns. If the patient is showing signs of shock, we're talking a blood pressure that's dropping low, they give a drug called tranexamic acid, or TXA. You can think of it as a super clotter. It basically gives the body's natural clotting ability a massive boost, helping to plug the leaks. And this isn't guesswork. The dose is super specific, exactly 2 grams. And they don't just slam it in. It's given slowly, over a couple of minutes. That precision is key to giving the medication the best chance to work and help stop the bleeding. All right, so they have a plan for PPH, but what if something else goes wrong at the exact same time? What happens when a crisis piles on top of another crisis? Well, a good protocol has a plan for that too. I mean, can you imagine? In the middle of all this, the patient has a seizure. That is a nightmare scenario. And it's a huge red flag for that other thing we talked about, eclampsia. So yeah, the plan absolutely has to be ready for that curveball. And this is what makes these protocols so smart. The PPH plan doesn't try to be a one-size-fits-all solution. Instead, it has what you could call a break glass in case of emergency clause. If a seizure happens, boom, it tells the team to switch tracks and open up the eclampsia protocol. It's like a whole network of plans that all work together. So let's zoom out for a second. What's the bottom line here? Why is it so incredibly important to have these pre-made plans, these protocols ready to go? Well, it's pretty simple, really. When things are chaotic and someone's life is on the line, the last thing you want is for people to be making it up as they go along. A protocol takes the guesswork out of it. It provides a clear, proven path to follow when every single second is the difference between life and death. So, How do you turn that chaos into a coordinated rescue? It really all boils down to one word: preparation. This isn't just some boring checklist. It's all of our medical knowledge, all of our experience, boiled down into a simple, powerful tool. A tool that lets a team of professionals walk into an impossible situation and, with calm, decisive action, save a life.